Joining us now, along with Corey, is Sarah Wiltshire, whose daughter has struggled with an eating disorder for years and who has been an activist and lobbyist trying to bring attention to the lack of medical insurance coverage for eating disorder treatment. Sarah, thank you so much for telling us your story. Piper is your daughter's name,
Yes.
and she's been struggling with anorexia since the age of 15.
Yes, she came to us in about 2005 and told her father and I that she was struggling. At that point, she'd been restricting, but then she had started binging and purging. And she said that she was doing that and she couldn't stop and she was terrified and she asked for our help.
Now, one of the problems for you, though, was you had health insurance.
Yes.
And she got so bad she couldn't walk, and yet you were struggling to actually get the health insurance company to pay for inpatient care.
It's traumatic enough to have your daughter kind of disappear before your eyes and you can't stop it. And throughout treatment, we were receiving really good help from the eating disorder professionals in the community through outpatient, but she was progressing in her illness, and quite often we would be met with denials. They would ask for an extra day of care and they would get denials. At one point in this journey in 2010, there was a team that our insurance had paid for. They had designated her to see, and she was seeing them, and then she was continuing to fail in her health. And the team came to her father and I and asked us that we should intervene, that she needed inpatient help, or they were worried that she wouldn't live. At this point, she was admitted to an inpatient facility in Chicago. And they were telling us that it would probably be months before she would be rate restored, and for her mind to have an adequate amount of healing, for her to even have therapy be effective for her. She was not well. And then after 6 days in this treatment facility, we received a call that our insurance company was going to stop payment. But at that point, when we thought we were very close to losing her, and we had thought that, but we were being told that by professionals, and then to have it be cut off.
After just 6 days?
After 6 days, when they were saying months, it was terrifying, and so I would try to call our carrier. I was just put off and put off and put off, and so I was desperate, and I didn't know what else to do, and I went to Hobby Lobby and grabbed some cardboard and grabbed some friends, and I went and picketed our insurance company. Just wanted to have someone to have a conversation about the insanity of this, and my daughter's life was on the line, so it was a desperate thing. And I'm normally a very reasonable person, and I'm a professional. I work with physicians, and
Yes.
It just was a desperate act, but it was a desperate thing.
We just heard in the Talia House piece, Corey, of families just like Sarah's who are in bankruptcy because of a child's eating disorder. You hear lots of stories like this?
Absolutely. So even if you have insurance coverage, they never cover your dietitian, and you have to see a dietitian to learn how to eat right or weight restored, as well as there often is limits to how long the insurance company how many days of coverage, whether it's outpatient or inpatient, there is.
Well, let's look at what the insurance companies themselves are saying. Take a look at this. The problem with covering eating disorder treatments, insurance say, is there's no universally recommended care plan for treating anorexia and bulimia. According to Susan Paisano, a spokeswoman for America's health insurance plans, quote, there's a lack of evidence for what works and what doesn't work. Corey?
I would strongly disagree with that. They have found effective treatment is having a treatment team of a psychiatrist, doctor, dietitian, therapist, and they also have found certain effective therapeutic techniques that are needed. Have I met people and worked with people who have been fully healed from eating disorder? Yes, absolutely.
So Sarah, how about your daughter Piper? How is she doing now?
Actually, she's doing really well. Thanks for asking. She lives in Fort Collins, Colorado, and it's a university town with a lot of eating disorder support there, and she's really locked into her recovery, and she's really leaning into getting support, and she's thriving, and it's really wonderful to have her back.